for everyone still signing on. This is Rosie Ledesma with the Benefits Department. We're just going to give it a couple of minutes and allow others to join the webinar. And then we'll go ahead and begin. So we'll be on in just about another minute or two. Hey everyone, my name is Rosie Ledesma. I am the Benefits Program Manager for Tucson Unified. I just wanted to welcome you all for attending tonight's webinar for the benefit review.
Okay, that would be eventually. Those are gone. So
We will, I want to be mindful of the time and everyone's time who is attending the webinar tonight. So we will go ahead and get started here very soon. We will ask that our attendees hold off on your questions until the end of the benefit review. Tonight we have our Tucson Unified School District consultant, Elvis Becerra, who is with Valley Schools, and he will be doing the presentation tonight. Again, if you have any questions, if we can please ask that you hold off until the end of the webinar, and we will be going over those questions. Also, at the end of the webinar, you will have the benefit staff contact information. So if we don't get to your questions tonight, you can always email the benefits team at benefits@TUSD1.org, and we'll be happy to answer any questions that you may have. So at this time, I'm going to go ahead and introduce Elvis Becerra, and we'll go ahead and get started.
Hello, everyone, and welcome to your 23-24 benefits enrollment presentation. I'm going to turn off the camera while I'm doing the presentation, so I won't be a distraction. I'm suffering from allergies, so I do apologize in advance. But if you do have any questions, please feel free to put them in the Q&A, and then we will address them as soon as possible. So with that, we'll get started. All right, let's go to the second slide here. Okay, so welcome to, like I said, welcome to your 23-24 plan presentation. Before we begin, I do want to recommend that everyone have a pen and paper handy in case you have any follow-up questions to ask about your benefits. Now may seem like we do have a lot of information that I'm going to give you, but it is going to be at a high level, so I do want to share that with you in advance. I'm not going to go into detail. One of the things that we were able to do is we had this video, this PowerPoint presentation recorded in a Brain Shark, So that will be available to everyone with that brain shark. Also in there, each of the slides does have an attachment to it. So if you're looking at your medical slide, you'll have your summary of benefits that you'll be able to review. So if you have any additional questions or concerns, you can actually refer to that. This is the one time of year where people are, where you can go in and do your open enrollment. So it's very, very important. If you miss this time, you won't be able to enroll until you have either a qualified event or next year. So I do want to make sure that you do understand that. Some of the helpful definitions that we're going to go over. So I want to read these one by one just to make sure that we understand. So you have a copay, which is a small amount required by your health insurer to be paid by the insured for each outpatient visit or drug prescription. So that did change this year. It did get lowered, and I'll talk about that a little bit later. Then we have your plan year. Your plan year runs July 1st through June 30th of next year. So your deductibles and out-of-pocket maximums are applied on the plan year basis. And then we do have the deductible, your specified amount that the insured must pay for a covered healthcare service during the plan year before the insurance company will pay a claim. And we'll go a little bit into further details in some of the other plans. You also have your co-insurance. So that's the percentage of the cost of the covered plan care service that each insured pays after meeting their deductible. And then the out-of-pocket maximums, and that's the most that you're going to pay for your covered health plan services during your plan year. So after you reach that out-of-pocket maximum, after you reach out-of-pocket maximum for your covered healthcare services for that plan year, the covered health services will be paid at 100% by the insurance company. Some of the stuff that we're covering today are going to be, it's going to be from your medical, flexible spending account, dental, Metlife, and talk about your short-term disability and others, some of the other things that are on this list. So the first thing that I want to share with you is that you should register for your UMR app. And one of the benefits, the big benefits with your mobile app is it helps you communicate with your doctors in real time. This is really important as a patient, since some doctors are able to learn and share some of the stuff in real time. Then in addition to that, you'll also be able to take a look at things like your ID card, estimate your care costs, access account balances, and check your benefits once you download the app. So once you sign up for your plan, the benefit is that everything is in your hand. You don't have to keep referring back to the brain shark to find out, or calling your benefits department to find out if if you're covered or you're not covered. So that's one of the benefits that you have on your app. So the first plan that you guys have, you have 3 different plans with the district. The first one is a PPO plan, and that's the PPO 750. The 750 for your individual deductible, plan year deductible, is $750. Your family deductible is $1,500, and that's for in-network. If you the maximum out-of-pocket that you'll have for that is $6,500 and $13,000. Now, you do have benefits if you do go out of network, but as you can see, you're not going to maximize your benefits like you are going in network, because you jump from $750 to $5,000 and then $1,500 to $10,000. So you're not out-of-pocket maximum limit for the year is $19,000 for an individual and $18,000 for the family. One of the biggest changes that you guys did have this year is your primary care physician went down from $30 to $15. So you have your virtual visits are all going to be covered. Preventative care is also going to be covered. Specialists is covered with a $45 copay. Urgent care is covered with a $50 copay. Your ER, you have a $500 copay. So one of the things that you can do is really use your virtual visit if you can before going to the ER or your urgent care to try to save quite a bit of money. So on your hospital stays, you are going to have your deductible and co-insurance. And then when it comes to pharmacy, you have 4 different tiers: zero copay, $40, $80, and specialty drugs. So depending on the medication. Your next plan is your high deductible health plan. So you have 2 high deductible health plans. The biggest thing here is, if you can tell, is that one is a $1,500, which has a $1,500 deductible for an individual. And then for the family, it did move to all your plans are this year straight across the board for the maximum out of pocket, they're $6,500. So for you have your family at $3,000, and then for in-network individual, the maximum that you're going to pay for that plan is $6,500, and then the family is going to be $13,000. Like I said before, you do have benefits out of network, but you're going to pay a lot more for the out-of-pocket. So on this plan, you do have your deductible and your co-insurance. So whatever the primary care physician is, it's a 20% plan. So you pay 20% and then your carrier pays the other 80%. Now, I do want to let people know the biggest differences between this plan and the first plan that I showed you. For the high deductible health plan, you have to meet that $1,500 before it starts covering. But the one benefit, if you're not going to the doctor a lot with this plan, it does cover your preventative care. So if you are doing your mammogram, pap smears, colonoscopies, all that stuff is covered on this plan. And then I'll get into a little bit more about how to be able to save some of that money and put some money away when it comes to the health savings account. The next plan that you have is the high deductible health plan 3,000. Now with that plan, your individual coverage, your out of deductible is $3,000, and then you have a $6,000 family deductible. The maximum out of pocket on that plan will be $6,500 and $13,000, and then your non out of network is going to be $5,000 and $10,000. You can also see that I forgot to mention in the other slide that your co-insurance does go up from 20% to 50% on the out of network. So that is a big deal. So you really want to pay attention. And that's why the app is really important, because you can find out what doctors are in network. If you have to go out of network, you have to go out, but you can see the difference in what you're going to be paying for the out of pocket. The out of pocket maximum is $7,500 and $15,000. One of the other things that I really like to mention with between the first plan and these 2 plans is if you're considering about taking the high deductible health plan, one of the things that I always consider is the first question that I always typically ask is, do you go to the doctor a lot? Because if you're going to the doctor a lot, this plan, the high deductible plans aren't really for you, because you're going to be paying a lot out of pocket and you're going to be really upset. So one of the things that I definitely recommend, if you have yourself or a spouse or a child, a dependent that's going to the doctor a lot, you probably want to stick to the PPO plan, because these high deductible health plans are really that upfront money can be, especially immediately on July 1st, these plans do reset. With the high deductible health plan now, if you don't go to the doctor a lot, the one benefit that you do have with the high deductible health plan is you're able to put some money away for those expenses. And the district, the other benefit too is the district is giving you the ability to, they're going to give you up to $1,500 for that high deductible health plan, and then you can also get an additional $300 for doing your wellness incentive from WellCoa, and I'll talk about that in a little bit. But the thing is, with this plan, you can put money away in your high deductible health plan, and the benefit is that it is on a pre-tax basis. So for an individual coverage, you can do up to $38.50 a year, and every year it does go up. And then for the family coverage, it is $77.50 a year. Now, one of the things that I want to make sure that people understand is that if you do have a high deductible health plan, if it works within your budget, you want to be able to put as much money away as you can, because it is pre-tax. So, and that money, this isn't a use it or lose it plan. This money is yours. So if you leave the district and you go to another district or you retire, whatever money you have in there, you can actually you take with you. The other thing is that if you want to, I'm not a CPA, but if you do have a tax person, you do want to talk to them, but you can invest that money if you want to. That's one of the benefits of having a high deductible health plan, the savings account. If you are over the age of 55, you can put in additional $1,000 a year. So just remember, though, the biggest thing to remember, like I said, is with this plan is that it is a pre-tax plan. So it comes out before your taxes. So you're able to save at the end of the year. And if you need to be able to save, if you're, going to go over that mark, this is the time that you can put that money away in your high deductible health plan. The nice thing is that you can change this. You do want to check with your district and find out when the changes are made. But some districts allow it monthly, some allow it quarterly, and some allow it yearly. So you definitely want to check with your district on that. Your high deductible health plan is with Optum Bank. So they issue you a card to make it easy for qualified expenses. It's payroll deducted. Like I said, it's pre-tax. You can write checks out of there and pay yourself, or if you have things that you're paying and for some reason you can't use your card. Like I said earlier, this isn't a use it or lose it rule. So you can take this money with you when you do leave the district. We will have on Rosie, I can't remember what day it is. If you can remind me, is it Wednesday that we're having the Wednesday or Thursday that we're having?
It'll be Thursday.
Okay, Thursday we are having, because this is a new provider, they are going to be going over, WEX is going to be able to talk about, and I'll talk briefly about this just to kind of get you prepared for that. The medical FSA, it is a tax, works like your HSA plan. It is your maximum contribution here is $30.50, and then you have the dependent daycare that you have up to $5,000, and then the limited FSA. So with these plans, the one benefit is that you can use it for out-of-pocket medical expenses, and that can be anywhere from if you're traveling more than 50 miles for mileage. There's things that you can. There's all kinds of, there's pages and pages, probably 25 pages that you can go and see what works. If your kids have braces, you can use this. But remember that the one thing is that you cannot use both the FSA and if you sign up for the HSA, you're going to be limited to the FSA only for the high deductible health plan, and that'll work only for medical and vision. But you do have dependent daycare up to $5,000. The one thing that I do want to share with when it comes to dependent daycare is that if you do have a spouse that is at home and you do send them to a daycare for some reason, for a facility, for whatever reason that they may have, that you have to send them during the day, you can use this money. It's not just for children. So I always want to make sure, and they'll talk about that a little bit more on Thursday. So please, if you want to find out additional information on how you can save money, this is definitely one of those plans. But again, this plan is a use it or lose it. But you can roll over up to $500 for the following year. And like I said, they'll discuss that on Thursday. So the next one here, the next slide here that we're going to talk about is your pharmacy benefits. Now, the big thing is with your pharmacy, you have to go on. What's really important, as soon as you get your medical plan, you want to go and visit caremark.com and register, or download the CVS Caremark mobile app onto your phone, what you're going to be spending for. If you're one of those people that likes to budget for the year, for the month, you're trying to figure out what it's going to cost you, refills. If it's less expensive for you to go through the mail service, go in. This is definitely what you want to do. You want to be able to immediately after you get your plan, review your SBCs, and then go to the pharmacy benefits and review your pharmacy benefits. So your district does offer a wellness. You guys do have a wellness coaching team. And the great thing with this is that they provide they will give you help, consultation on nutrition, weight loss, sports and fitness, stress management, self-care, disease prevention, and management. So if you want additional information, you can go to you can click on this that will be available on your PowerPoint, your brain chart. And then you, like I said, you have 4 health coaches. In addition to that, on the next slide here, you can add an additional $300 annually on your PPO. You can just by doing some of these things. And if you do have questions on that, just reach out to the benefits department or one of the coaches at WellCoas, and they'll be able to help you out and walk you through that process. With your employee assistance program, one of the things that the great benefit here is that it does cover for those wellnesses, those unexpected things. If you're having issues at home or at work with the kids and you need additional help, your district does provide your employee assistance program through Jorgensen Brooks, and then all you have to do is go online. You'll be able to complete the form, and then a specialist will be able to provide you with the additional information that you need. You also have availability for child care, elder care, school and college assistance, adoption assistance, and pet services. So this is something that your district does pay for. So it is something that resets every single year. So you do want to make sure that you use this benefit. And if you have any additional questions, you can reach out to your district or just reach out to Jorgensen Brooks and talk to them, and they'll be able to walk you through that process. Now, your district has 3 different dental plans. So the first couple of plans that you have here, the first one I'm going to show you are your PPO Delta dental plans that are offered through Delta Dental. What we're looking at right now is your high plan, which gives you your maximum out of pocket. The difference between this plan and the next plan that I'm going to show you, really where it falls, is just the $2,000 annual maximum benefit that you have. What I love about your plans is they both offer orthodontia. They don't offer the same amount, but they do offer orthodontia, and that's from adults and children ages 8 and up. Annual deductibles of $50 for an individual, $100 for a family.
But however, I won't be able to answer any questions, right? Go ahead. Mhm.
Okay. And then your preventative services, you do have at 100% for your basic, 80% for major, and then your preventative service at 100%, 80 for your basic, and then 50% for your majors. One of the things that you do want to make sure is that you go and probably the first thing with this one is I always tell people to go and download the app, your Delta Dental app, because there are 3 different providers that they have. There is a premier provider, a preferred provider, and I can't remember the third one off the top of my head, but it does give you want to be able to, you can go on there. One of the things that I've used it for is being able to, if you're going to have like a root canal, you want to find out where the least expensive one is, you can actually go on your app and find out, plug in your area and see, what they're charging, because you are paying for that. So your out-of-pocket expenses. So that's one of the benefits. Also on this plan, you do have out-of-network dentist, but you can see that you're losing like $500 annually on that benefit. You do have the lifetime orthodontia that's the same, annual deductibles are the same, and the preventative services, but out-of-network, like I said, you want to get the most that you can by going in-network to your in-network doctors. So Your next plan that you have, if you're not going to the dentist a lot, this is probably one of the plans that you have if you don't have a lot of work that you need. Because on this plan, you do have, it is half the limit that you have on your high plan. This is a 1,000 annual maximum benefit, lifetime orthodontia of $1,000. And then you have your $50 annual deductible for individual and $150 for the family. You do have your preventative services covered again at 100%. Basic is at 60 and then 40. And you also have, like I said, you do have out of network coverages, but if you want to maximize, you know, the amount of money that you're, you know, for your in-network dentist, you'll probably want to use your app. And like I said, I've used it quite a bit. It's a great tool to have, being able to find dentists that are in network. So you can use your maximum benefit on that. Now, your last plan that you have, it is a prepaid plan. So the prepaid plan does cover services. The biggest differences with this plan is that if you're a planner, this is your plan. You're going to be able to go and know exactly what the diagnostic is going to cost you, preventative, all of this stuff on here, the oral orthodontia. So it does have a list, and your district does have a list. We did put that information inside of your brain chart presentation, so you can go in there, or if you want to go to www.mydentalplan.net at Employers Dental Services, you'll be able to go in there and take a look at what each thing is going to cost you. So if you're going in there for a root canal, if you're going in there for a bridge, whatever it is, you'll know exactly what it's going to cost before you go in there. So now this plan is a VSP plan. This is your vision plan. We switched over from IMED, and they're going to also be having a presentation on Thursday. So I won't spoil this, but you do have some great benefits here. Glasses every 12 months, $130 allowance. But if you do go to Vision Works, you get an additional $50, and they're going to be talking about this all on Thursday. So I'm not going to get into the details on this just yet. So I'll wait till Thursday. Now, with your basic life insurance, the district does offer you life insurance. Basic life insurance will be offered when the employee completes enrollment and includes a beneficiary. If you don't complete, incomplete enrollments will not qualify for basic life insurance. So you've got to go in there and make sure that before you get started, that you're bringing a list of your beneficiaries. I always try to share with people that you don't want, when it comes to beneficiaries, you don't want to have your kids, if they're under the age of 18, to make decisions when it comes to life insurance. If you have someone that is over the age of 18, remember too, if you do have kids that are older and you want to split it up, you can split it up evenly amongst all your kids. So you want to bring, before you start open enrollment, you definitely want to have a list of beneficiaries and also have their social security number, so you don't have to start and stop your enrollment. So that is one of the things that, like I said, your district will be able to provide you, does provide you with. The district provides coverage up to 1 time your basic annual earnings up to a maximum of $200,000 with no medical questions. So remember, the big thing on this is that this is group life insurance. When you leave the group, you leave the life insurance. So if this is the only insurance that you're counting on, you want to have additional life insurance outside, if that works within your budget. But when you leave the district, one of the biggest challenges that I've seen over the years of people who have worked at the district for 10, 20, 30 years, they're ready to retire, think that they have a life insurance policy, and all of a sudden, when it comes to life insurance, you know, or if you do have the portability acts, if you can take the life insurance policy, it does cost you a lot because now you're rated at the age that you're leaving. So it's usually pretty high. So that's some of the things that I always try to share with people when it comes to life insurance. The next one is here, your supplemental life insurance. So the district does offer you life insurance, but you also have that you can get additional life insurance for yourself, for your children, for your spouse. The one thing is when it comes for eligible employees may elect supplemental life insurance in increments of 10,000 up to a maximum of $1 million, and not to exceed 6 times your basic yearly earnings. The initial eligibility is 250 or 3 times with no medical questions. So that's a big deal. Most of the time when you're getting life insurance on the outside, you may have medical questions, and your district is able to provide you life insurance here. So one of the things that I tell people, as soon as you come in to the district, you want to sign up for the life insurance, because one of the things, if you do get sick or something does happen to you and then you're trying to get life insurance, you are going to have to provide the evidence of insurability, which is their medical questions before approval. So this is definitely a way to get additional life insurance for yourself, for your family, for your children, with your children and your spouse. The election can't exceed, for your eligible employees, your spouse can't exceed 100% of the employee election. The initial eligibility limit is $25,000 with no medical questions, and your children can get in increments from 1,000, 5,000, and 10,000 on children, 6 months all the way to the ages of 26. So your district does offer Sun Life short-term disability. Now, with the short-term disability, I always let people know that you should have, when it comes to short-term disability, most people ask, well, why do I need short-term disability? Well, the reason is, I always, when I used to sit down with people in my previous at my previous employer, we would talk about short-term disability, and the first question I ask is, how long can you last without a paycheck? When it comes to short-term disability, the one thing is really what you're replacing is in the event that something happens to you outside of work. And what I mean by that, this isn't a workers' comp. Your short-term disability will not cover you for a workers' comp. It will only cover you for anything that happens outside of work. So if you have a heart attack, or you have a stroke, or you have a car accident or pregnancy, this is what that policy is for. Now, if you are new to the district and you want to add, thinking about getting pregnant, you do want to have this policy in place before, because there is a look back period. So if you're signing up for this policy on July 1st and you've been pregnant for a month, this policy isn't going to pay you. So that's the big thing that I always try to explain to people. You want to have this policy in place before anything happens. If you have this policy in place and then you ended up getting pregnant a couple months later, that policy would cover, but there is a 12-month waiting period, pre-existing conditions that they look back. So if you are sick or going for treatment, so if you're doing, you have a heart condition, and all of a sudden 6 months down the line, you end up getting taken out of work because of your heart condition, and they will look back. Now, if you've been on the plan for over a year, you are good to go. If you had the plan and you've never gone out, there's a couple of different options that you do have with the district, which is really nice. So depending on your budget, you have option 1, 7-day injury, and then a 14-day illness elimination period. And then option 2 is a 14-day injury and a 21-day illness elimination period. So really, when you're looking at those, it's just what it's going to work out to. It's based on your budget. How long can you go without that paycheck so it really starts to affect you? And that's how you calculate what policy will work for you. Now, talking about the Metlife, now a couple of the next couple plans that I have are they're voluntary products, but I really like that your district does offer the Metlife critical illness plan. Now, the critical illness plan, what it is it pays you a lump sum benefit in the event that you are diagnosed with one of these conditions. Most people will always ask, hey, if I have medical insurance, why would I need a lump sum benefit? Well, I want to give you a couple examples on the first two. If a person is diagnosed with cancer, one of the things, depending on the severity of your cancer, you're really not going to know how long you're going to be taken out of work. Where your policy, your insurance, your medical insurance policy is going to pay for you going to the doctor. But one of the things that it's not going to pay for is your rent, your car note, all your bills that you have coming in, your cell phone, food, putting food on the table. With this plan, the one thing that it does, it gives the people ability to be able to continue with your everyday life and not have to worry about rushing back to work either. When I first started out my career, I used to work for Aflac at one point, and I remember that I used to ask people, why did you buy the cancer plan? One lady told me is she didn't want to go into her savings and spend all of her money. And as I saw throughout the course of my career, that, when it comes to cancer, people will spend all kinds of money to go and see the best doctors. God forbid, if it's one of your children, you'll sell your house, you'll sell your car, you'll do whatever you can to help your child during the event of cancer. And this is what this policy is for. It really helps people because it is a lump sum benefit. And now the great thing is with this lump sum benefit, it's not tax. You don't have to claim this. It's not coordinated with any other of your other benefits. So if you do have short-term disability and you're getting short-term disability and you get a lump sum benefit for cancer, that money goes straight to you and you decide what you're going to do. So if you have money in the bank, if you want to take a vacation after your cancer is done, you can do that. The money is yours. So the same thing with a heart attack and a stroke. If you do have a heart attack or a stroke, the one thing is with that plan, it does pay you for that lump sum benefit. Where the heart attack or stroke, if you were by chance, if you needed special equipment for your car, or you needed a ramp to your house or wider doors for your house, your medical insurance, you guys have great medical insurance, but unfortunately, it's not going to pay for any of that stuff. That's all going to be out-of-pocket expenses. And that's what these plans will do. So this is definitely one of those things that you do want to take a look at. Like I said, again, if it works within your budget, you do want to take a look at this plan and see if it works for yourself or someone. If you're prone to cancer or heart attack, stroke, those are some of the things that you do definitely want to take a look at. And these policies are portable, so when you do leave the district, you can take the policy with you at the same exact rate. So the next one is a big one with the Metlife legal plans. I do want to share when it comes to estate planning, money matters, real estate. Most people don't think about this. I think with COVID, a lot more people were able to see how they weren't prepared for COVID. When people passed away, really, if you don't have a trust or you don't have a will, this is definitely one of the things that you do want to be able to provide to your family and have all that prepared. You're looking at, on this plan, I think it's $18.50 a month to be able to go and to prepare all that stuff. The other thing is you don't want kids to be making decisions if you're on life support and they have to, one of the things with these plans, you'll be able to sit down with an attorney, make some decisions beforehand. So all of this is done because you never know when something is going to happen. In addition to that, you can have, if you have questions for your family, for your parents who are now elderly, and you do want to be able to have power of attorney. Traffic offenses is a big one, documentation, preparation, immigration assistance. I think the only thing that they won't allow you to do is sue your employer. So this is not the way to go with this plan. So, but it is one of those plans that you definitely works, and you're able to do a lot with it. So you don't want to leave things to the state to make decisions on when it comes to your children, when it comes to your money. You don't want family members fighting for it. And some of you may have experienced that. This is definitely one of the ways to prevent that. For less than what it costs you to buy Starbucks every single week. This policy will definitely cover you and help you and your family. So this plan, you do have a couple of pet care plans with the district. Now with this one, it's the only plan that it is payroll deducted. So there have been some changes. They did put some additional perks in there. So you do want to take a look at the flyers and find out what the big differences are and the changes are. Obviously the big thing that you'll see right away are the rates. But in addition to that, you just don't want to look at the rates. You want to be able to look at why, what's the increase and what am I getting? Especially if you have pets, older pets. This is definitely a service that'll help you, but there's more additional information. There's additional flyers that you'll be able to go and take a look at on the Brain Shark that are attached to the Brain Shark. This plan here is nationwide pet insurance. The one benefit with this one is if you don't want to sign up with the district on a payroll deduction, you can go in and sign up with nationwide at any time. So you don't have to wait until open enrollment. Another thing is with this one, you do have exotic, they do cover for exotic pets. And I think the other one does too, but you do have to just take a look and find out what works within your budget. So really, you have the two different plans, which are great plans, but one with nationwide, you're going to be paying for it out of your credit card. The other one is going to be coming out of your check. So whatever works for you. And I think that is it for the end of the open enrollment here. So if you do have questions and you want to get in touch with the district, Rosie's going to come and share a little bit more about some of the things that you do have available to you as far as open enrollment, your portals, additional help that you may need. So I will go ahead and let her answer that. And then if we do have Q&As and if I can help answer them, I'll be more than happy to do that.
Thank you, Elvis. And thank you again to all of our attendees on the webinar tonight. We hope that this overview was, beneficial information for you all. As Elvis had mentioned, it has been recorded into a presentation of the Brain Shark with additional materials attached to that video. You can find the Brain Shark as well as all other material pertaining to annual enrollment on the district benefits SharePoint page. One key piece that I wanted to share with everyone is please continue to watch your district email, as that is how the benefits staff is corresponding with all of our benefit eligible employees and providing up-to-date information on the enrollment period. Another important piece of information is please be aware that the enrollment period does run from yesterday's date, April 3rd, and it will end at midnight on April 23rd. The portal will automatically close. Your benefits will not roll over. If you currently have benefits with the district, they do not roll over even if you miss the enrollment period. All benefits that you currently have will automatically terminate June 30th unless you go in there into the portal and complete your enrollment for the new benefit plan year of July 1. We do have our benefit email address here on the screen. If at any time you have any questions, maybe even questions you think of after we close the webinar tonight, feel free to email the benefits team at benefits@TUSD1.org, and we will definitely do our best to answer your questions. The one thing that we cannot do is kind of steer you or direct you to what plan may be the proper choice for you. As Elvis had mentioned throughout the presentation, a lot of it is going to depend on your own personal needs, medical needs, as well as your budget. So just keep that in mind, that we as staff cannot make those decisions for you, but we will be happy to answer any questions that we can. If you have any trouble while you're in the portal making your elections during the enrollment period, again, please reach out to the benefits staff within the enrollment period so that we can troubleshoot and, walk you through any any trouble that you may encounter within the portal. I think we are ready to go to the Q&A. We do have some questions in there. So we will go ahead and I think, Elvis, are you able to see the Q&A?
Yes,
Okay.
I answered one already. I think the first one here that I want to talk about real quick, it says, can employees have district PPO plans, insurance, and third party not supplied by TUSD an HSA account? No, it's an IRS rule. Like I said, I'm not an accountant, but you do want to check with your tax person first. So if your spouse is on a HSA account and you're on a PPO account, you're going to have tax issues. I can tell you that. I'm not a tax person. Like I said, you want to consult with a tax person. So that's the first question on that. The next question that I have, and if you have any additional questions on that, please feel free to respond on there. The next one that I have is with virtual visits, if the doctor charges a fee, how do we get it refunded? Well, I mean, I think that you really want to go, the first thing that you want to do is find out with your call UMR and find out if that doctor is in network, because you could just have gone to a doctor that is out of network. So if you do have any issues, just contact the district and we'll be more than happy to research that for you and get some additional information from you, and then we can find out for you and be able to help. So I hope that answers your question. It says, hi, if I'm pregnant and applying, do I still qualify for benefits? If so, how does leave for that work? Rosie, do you want to answer that one?
Yeah, so a couple of things. If you're currently pregnant and we're running annual enrollment right now, if you are interested in making benefit elections, those benefit elections would be for your current status. You know, if it's just yourself and you're covering yourself for the July 1 coverage, those are the elections that you would make right now during annual enrollment. If it or when you do deliver, you would have 30 days from the baby's delivery date to send in a written request to the benefits department, letting us know the baby's birth date and that you would like for us to open the portal under the qualifying life event of the birth of a child. And at that point in time, within that first 30 days is when you would be able to go into the portal and add your dependents to the current coverages that you have at that time. If you have questions regarding the leave process and what type of district leave you may be eligible for, I would recommend that, again, you send an email to benefits@TUSD1.org, and one of our leaves associates would be able to assist you with that process in inquiring for a district leave of absence. And leave of absence is required, or the request for a leave of absence is required by all TUSD employees if they are going to be out more than 10 consecutive days. So on that 11th day, if they are still out and going to continue to be out, they are required to reach out to the benefits department to see what type of district leave they may be eligible for. And this is true for even employees who have been with the district and have a lot of leave accruals. So even if you have enough accruals, whether it's personal leave, vacation, or sick time accrued, even if you have enough time to be out, 3+ weeks, you are still required at that time over 10 consecutive days to put in for a leave of absence. So just please keep that in mind, or just future reference.
The other thing that I just wanted to share with you too, if you are pregnant and you haven't signed up for the disability plan, most people think that, well, I'm already pregnant, so it's not going to matter anyways. The big thing is when it comes to the disability plan, it covers you for anything that's outside. So meaning that if you had postpartum depression, let's say that God forbid you got into a car accident or you got sick from the surgery, or if something happens outside of the pregnancy, you're also covered for that too. So remember, it's not a pregnancy plan, and I don't like to present it like that, but it is a disability. So in the event that something does happen, and things do happen, So if you want to protect your paycheck, now, if you have, if you're, you tell me that, hey, Elvis, I'm good for 6 months. I don't need, I'm covered for the next 6 months. I have enough in savings. Then you probably don't want to sign up, because you do have, with ASRS, the long-term disability benefit that you have there. So that is one of the things that I just want to make sure to go over when it comes to the disability. So the next question that I have here says, so I'm 8 weeks pregnant and trying to sign up for benefits. Is there anything that I can do to help myself? I think, Rosie, you kind of answered that question. Unless you have something else that you want to share on that one.
Yeah, no, I will just ask that particular attendee, if they have additional questions tied to that, again, please feel free to either type it into the Q&A. If you feel that between Elvis and myself, we have not fully answered your question, or email the benefits team and we'll be happy to go over that. But I think between the annual enrollment period and what benefits you currently have and what it looks like for the qualifying life event, as well as short-term disability, I think we may have answered that. But again, if the attendee feels that there's still more to it, please go ahead and type it in.
Absolutely. And these are all great questions, by the way. I do have a person here that says, with the Metlife critical illness plan, if you had a few years ago, and use it for, let's say, a heart attack, now a few years has passed and did not keep the plan, can you sign up for it again to be covered for the same event, or would it be non-paid as a pre-existing event? Well, usually what they'll do is I would just check. We can double check on that one if you had the plan already and it paid out. I don't think, but I'll have to double check on that question, this particular question. I think you can sign up for the plan, but I will say that with other critical illness plans that I've seen in the past, if you're currently taking medication or being treated for that plan, most likely it may or may not, they may or may not give you that plan. So, but we can do some additional research on that and get back with you. You are under anonymous. So if you want to send in an email to the district office so that we can contact you, otherwise I don't have, you just signed up as anonymous. So I won't be able to get that information back to you. But if you want to reach out to the district, I'll be more than happy to get that information for you and do some research on that. The next question, it says, I'm still not understanding the differences between deductibles and the out-of-pocket maximums. Okay, so let me go back if you don't mind here. Let's go, oops. Just to go real quick. So with it, and I'm going to use the individual, I'll use the individual plan here, the PPO plan. So the individual, the deductible, your deductible for plan year, you're going to have, so it's going to be, your individual deductible is going to be $1,500 or $750 here. And then every time you go to the doctor, so since the primary care physicians visits were reduced, they went from $30 to $15 this year. Every time you go, and you're going to have that $15. Now, for the out-of-pocket maximum, so that if you're going to get to a point where, let's say that you ended up going to the doctor and you were in a car accident and you had out-of-pocket medical expenses of $7,500, you're an individual. So because you've already met your maximum for the year, which is $6,500, everything moving forward, you're not going to have to pay anything out of pocket. Here you have co-insurance of 20%. So every time you go, you have 20% that you're going to be responsible for, plus that primary care visit. But if you do go out of network, that is going to change. So I'm hoping that makes sense. So, and then on the high deductible plans, you're going to see here, it's $1,500 for the individual. That will be your deductible before the insurance even kicks in. So that's the difference here. It's $1,500 and a maximum out-of-pocket expense. So for that same accident, if you had $7,500 in bills, after that $6,500 was met, you wouldn't be paying for anything. So that's what, and I hope that answers your question. If you do have any additional questions on that, you might want to be able to take a look at your SBCs, your summary of benefits, and they have examples there, or you can call the district office and then we can go over it a little bit further. So let's see. The next question is, I'm still not understanding the differences. Oh, sorry, that's the same one. Or do you have to use your CVS pharmacy only for prescriptions, or CVS just the name of our prescription insurance? No, it's just, Rosie, do you want to answer that? It's just for.
Yeah, so right now our pharmacy provider is under CVS. However, you're not required to only go to CVS pharmacies to fill your prescriptions. You can still utilize, your neighborhood Walmart, your Walgreens, whatever you choose. But being that CVS pharmacy is our administrator on that side for prescriptions, utilizing their mail order prescriptions, you're going to see more cost savings there. So again, you want to be able to sign on to the CVS platform, and you can even put in, if you have a prescription that you use regularly, you can always put that into the search within the CVS webpage. And on there, you'll be able to see if it's, first of all, covered, and second of all, under the CVS mail order, where you can get like 90 days of your medication at the price of 60 days, or rather 60 days of the cost, right? So 2 months prescription, you get 3 months prescription at the cost of 2 months.
Yep.
With those cost savings. But no, you can go to any other pharmacy. It does not have to be just restricted to the CVS locations. So I hope that answered it. But again, utilizing a lot of these platforms for our carriers, you can definitely find a lot of the information ahead of time before, you're actually going to the pharmacy or to the doctor. As Elvis had mentioned, the UMR platform where you can create your own login. You can see in-network doctors, even the virtual doctors. You can see who's a provider on there. Someone had asked, how do I go about getting that refunded if the doctor wants to charge me? All of that can be looked at before you even schedule that appointment. So, consider creating those logins, and everything is pretty much right at your own fingertips. I personally use those as well. Just, it just saves a lot more time than, calling the customer care service and speaking with an operator. You can just put in your own information. You can track your claims. Someone had a question about the deductibles and out-of-pocket max. It will track all of that for you, so you have an understanding of where you're at with your own deductible and out-of-pocket max. So if you have questions about that, like Elvis had mentioned, it's all available on the Brain Shark. You can find all of the materials in the benefit SharePoint as well.
Great. Thank you. Thank you, Rosie. The next question that we have is, how much is taken out of each paycheck for the 3 medical plans? I think for that, you definitely want to go on the portal. Once you get in there, you can just kind of plug in who it is that you're going to cover, and it'll give you all that information inside of there. So.
Right, and you are correct, Elvis. That information is in the portal. So when you're completing your enrollment and you get to, for example, the medical page, you'll have 3 sections, actually 4 sections within the medical page. It's going to be the PPO, the high deductible 1,500, the high deductible 3,000, and over to the right of each of those tiers, there's a drop arrow. And once you hit those drop arrows, it's going to show you the cost per pay period, depending on, are you choosing employee only, employee spouse, employee children, or employee family? So depending what level of insurance you're choosing, as well as dependents being covered, it will show you within the portal. The pricing within the portal is based on all of our current employees that will begin deductions at the beginning of the school year in the fall. We start our deductions on pay period 4. So even though your plan year begins July 1, and that's when your coverage becomes active under the new benefit plan year, please note that payroll will not begin to take any benefit deductions until the month of August, when we get to our pay period 4. And that is when you're going to see your first benefit deductions coming out.
Thank you.
Mhm.
The next question is the supplemental life insurance portable? Yes, it is. I always do caution people just to do a little research when it comes to your life insurance. Because remember that when you are taking some of these policies, it's at the cost of the age that you're at when you leave the district. So one of the things, if you do want to lock in rates, you definitely want to take a look at all of your options. That may not necessarily be with the district, but I always tell people that, pay attention and make sure that what it is that you need when it comes to life insurance and how much money you need. So like I said, your life insurance is portable. The next question is, I'm retiring from the district. Congratulations, and I'm jealous. And I want to go on my husband's insurance, who's also a TUSD employee. How do we go about adding me to the plan? And do I have to still sign in and waive my insurance, even though I will not be an employee past May 26th?
Okay, so for this employee, and I don't know what your position is, but depending on your work calendar, for example, teachers, some of our certified staff are under contract and required to work through May 26th. As long as they meet that date, because that is their work calendar and what they're required to work through, your benefits would terminate June 30th. If you know for certain you're not returning, you can either go in and waive your elections, or, if you kind of let the enrollment period pass, that's a decision for you to make. As far as going on to your spouse's insurance, once your insurance terminates as of June 30th, it would be up to your spouse to send the email to the benefits staff to request that the portal be open as a qualifying life event, indicating that you were a former TUSD employee who had recently retired and they are interested in adding you to their coverage. And I say that it would be up to your spouse to send that inquiry to us, because they would be the ones under the benefit plan at that time. And they're the primary that would have to request that qualifying life event. But yes, as long as you're no longer an employee of the district, and it's within 30 days of when you lose coverage, it must be within 30 days of you losing coverage that request come to us, you would be eligible, or your spouse would be eligible, to put you on their plan under a qualified life event.
Thank you, Rosie.
Mm-hmm.
Now, the next question here is, I have to undergo major surgery during June. Will it affect my benefits? Well, the only thing is, it will affect your benefits if you go anytime. If it's before June 30th, you should be fine, because whatever deductibles you have, your maximum, your out-of-pocket limits for the year. Remember, if you do it after July 1st, everything is going to reset, so you're going to have to meet that all over again. So if you do have major surgery and you need to get it done, get it before your plan resets on June 30th. It says, the next question is, my diabetes meds expenses are $1,000 per month. Do the high deductible plans cover the meds? I also see the doctor every 4 months plus get lab work. Would this be wise to get? Would this be a wise plan to get? Well, the only thing that I want to share with you is on the 750 plan. If you're going to the doctor every single month, your co-pays for your pharmacy are $0 for tier 1, tier 2 is $40, tier 3 is $80, and specialty drugs are, if you're participating in the Prudent RX program, otherwise 30% co-insurance. So you're going to have a 30% co-insurance. If you go to the high deductible health plan, you're going to be responsible for that co-insurance up to that. So if you're an individual, that first $1,500 is going to be yours. And then after that, $6,500. So it really just depends on those out-of-pocket expenses. In addition to that, you do want to you do want to be able, what I would encourage you to do, and this is just me personally talking, if you can talk to some of the wellness people, because they do have some programs that they are helping to hopefully be able to help you reverse some of that diabetes and possibly lower the cost of your monthly, that $1,000, and especially getting lab work done. So if I had to, if it, were up to me, I would probably be looking at the 750 plan instead, because you don't have, that 20% co-insurance that you're going to be having every single month when you go to the doctor. So, but you want to, like I said, you want to do the math and see what works within your budget. So if you have any additional questions, please let us know. And then the next person that we have here, and I think this is the last one, is there additional expenses when you see a lawyer for estate planning, or is it just the $1,850 taken from your paychecks for the plan? Great question. It's just the $1,850. There's no additional. I know that when you're having the documents prepared, if you want to register them with the city that you're in, if you want to file when it comes to like a deed, or I'm sorry, a trust, there may be additional expenses on that end, but if you're going to do it yourself, there's not going to be any fees. So like I said, this is great. I had one of my coworkers, her mother-in-law passed away, didn't have the estate planning. She decided to do it for herself and her family because it was just such a mess. She was able to get everything done, and it was for, that $1,850 a month. So let's see if there are any additional questions that I missed. I think we're good. If you guys have anything else, this is the time to put your questions in here. So I think we're good. Rosie, I don't think there's anyone else. So
Yeah, the webinar was scheduled through 6:30, so I think we did pretty well. These were really great questions. I appreciate the questions coming in. I'm glad that we were able to answer the questions under the live webinar, because I'm sure some of these pertain to others that were attending as well. But if we did not answer your question fully, or you still have additional questions, I will ask that once again you send those inquiries to benefits@TUSD1.org. If possible, please include your employee ID number as well, and we'll be happy to look into those further.
awesome. Well, thank you very much, everyone. I really appreciate you guys attending. And like Rosie said, we gave you a lot of information today. So if you do want to take a look at the brain shark, all of that information is covered in the brain shark. You can start it and stop it as many times as you want. In addition to that, all of the documents, the supporting documents, your SBCs, your flyers, everything is in there that you need in order to answer your questions. And if you can't find the answer, then just reach out to your benefits department. They'll be more than happy to help you. Thank you, and have a good enrollment.